I'm now sitting on the wobble seat. This is really important for your care, because this is going to prepare the lower half of your spine to receive the adjustment. Many of you, since you're sitting down for so long, all day long, or now we're texting, we're doing things where we're looking down, our spine is in a really crappy position. So the wobble seat really helps warm up your spine. It warms up all the tissues. It's warming up your muscles, it's warming up the discs, it's getting blood supply into the discs, into the muscles, and this is how we warm up. And your spine is much easier to adjust. Your brain has better control, better comprehension of your space. When we make the adjustment, it's going to have more communication to the rest of your body. And one of the things that many people don't know is out of the Journal of Spine, they've shown that people that have more motion in their spine when it's moving properly through doing these exercises, it's actually nutrition for the brain, and that nutrition to the brain is what helps communicate with our organs. So we might think that this is just for our spine or our disc, but this is actually feeding life and health into your organs so that they can heal and repair and function at their optimal level. Now, what we're seeing people doing the wrong way is that they're doing it too slow. And slow is okay at first as you're learning how to do it and you're learning the motions, but just this is not going to warm anything up. All it's going to do is it's going to be a stretch, and we're not stretching our body when we do this. So the other thing that they do is they go from side to side like this, and they're just stretching. Right? Or when they do the twisting, they're just going like this, and they're doing it too slow. So we don't want to do that. The other thing that we notice is people are accentuating the movement. So when we go front to back, they're touching the floor, and then they're going back and touching the floor and doing that. Or they're trying to go way too far this way and way too far that way. Remember, there's other people here. And they're trying to stretch, they're trying to be an owl and turn all the way around. That's not what we want. So let me show you the three exercises, or the three different ways to do this, and about the speed that you want to be doing this. What you want to look for is, once you're done with this, is you should feel a little warm. You should feel like you almost did a workout, because this is a warm up. So your spine and your body should feel warm. So this is what it looks like. We're going to start out front to back. A good pace. Okay, just like that. And then from side to side, that's the next one. We go from side to side. Like this. I close my eyes, because if I don't, I'll get dizzy. And then I twist from side to side. I want my head looking back this way, and my head looking back this way. And then I twist my arms. Okay? And then the other thing that you want to do when we're twisting is you want your pelvis to rock, or your hips to rock back and forth when you do this. Okay? Just like this. Now, the worst thing that you can do after you do it the right way is, for those of you that we've seen, that now you get your text or your cell phone out and you start reading and you're doing this. Gravity, and research shows that as soon as you stop doing that, your spine is going to go back into that position, and your ligaments will start to shorten, and it's going to make it harder for you to get your adjustments. So just put these away, you guys. We're trying to make it so that you don't spend that much time away from your phones, but you can put it down. If it's a complete and absolute emergency, we understand, but just for the time that you're in here, please either leave these in the car or leave them in your purse, put them on silence, and really start focusing on you, because what you focus on will expand in your life. And if you want more health, you want better adjustments, then this is the time to focus on it. So the things that we want you to do after your adjustments is, I write a newsletter every week. I write this to fill your brains with the latest research, different questions I've heard, or just something that intrigues me that I'm dealing with in my own life, in my own personal life, and I just want to get it out to you to inspire you guys. So what you want to do is you just want to continue to move your spine. Just keep it moving. You want to keep that blood flow going. When I see people reading these things, I'm going to start noticing after this video, I'll start picking up the pace when I make my adjustments. I'm not going to I'm not gonna not do what I need to do, but we're gonna get you taken care of. Or the other thing is when we play videos, you know, just watch the video, go back and forth, okay? This way. Obviously you can't turn anymore, but if you know your number's coming up, then you can start getting ready. If you feel like it's taken a long time, I want you to get back on doing this, okay? Now, I can't do this for you. I can't force you guys to do it. So your results are determined by the commitment and the expertise that you do it at. So we love you, take care of yourselves, and we want the best for you.